Okay. Okay, good morning, or I should say good afternoon. Good afternoon, everyone. Thank you for being here today. Thank all of our community leaders, county, city, community folks out in the Clovis area. I think that thing's still on. Okay, and out in Curry County as well, and emergency managers. So we want to thank you for being here today. I'll start off by saying my name is Jimmy Masters. I'm the Regional Director for Southeast Region Public Health Division. I'm based out of Roswell, but we do cover 8 counties in the Southeast region, including Curry. And I think we do have some people from Roosevelt as well. And so, again, thank you for being here. And I'm going to make a couple of other introductions. I have up here Teresa Breaker, who is our nurse manager for the Clovis Health Office. Carrie Redden, who is our Director of Nursing Services for the region. And then on my left, we have, I'm blanking right now, Mike Landon, Dr. Mike Landon, who is our state epidemiologist from the Epidemiology Response Division for the Department of Health. And then we also have Eric Chenier, who's our Deputy Secretary for the New Mexico Department of Health. And so the way it will work, we do have a presentation about coronavirus and COVID-19, but we're going to start off first with Deputy Secretary Chenier. He has an opening statement, and then we will move into Dr. Landon's presentation around COVID-19. So thank you.
All right, can you hear me? Thank you very much. This is Dr. Landon and I's last stop on a 3-city tour. We did Las Cruces yesterday, Roswell this morning, and thanks for having us here in Clovis. So why are we doing this tour this week? We want to ensure that the public and the local populations and partners are fully informed and prepared so that you can stay healthy. Department of Health's #1 mission, goal, priority is to protect the health of all New Mexicans, and that's why we're here. I will start off with a high-level overview, then hand it over to Dr. Landon for more details. So I want to reiterate, and we'll probably reiterate this several times, but New Mexico has not had one single confirmed case of the coronavirus that causes COVID-19. We are currently working to identify cases as early as possible and implement isolation procedures to prevent further spread of the virus should we have a case. We want to reiterate that the majority of cases, about 81% of them, of when people are experienced in China and other places, is that about 81% of those who have gotten sick have very mild symptoms. Typical symptoms are fever, cough, and shortness of breath. The most heavily impacted and vulnerable populations are older people and individuals with chronic illnesses. Only about 2% of those who get infected are children. Most recently, we have experienced increased cases of person-to-person spread on the West Coast. And globally, China has the greatest number of cases that have come out so far, but now case growth is most significant in other parts of the world. The department is working with the healthcare system to ensure the availability of beds and personal protective equipment. The Office of the Secretary and the Epidemiology Division have conducted or are soon to conduct a large number of calls and webinars with employer groups, elected officials, legislators, hospitals and provider groups, universities, child care organizations, school district superintendents, and several other groups. The department has been releasing press releases at least weekly, is communicating with other state agencies by providing guidance and other materials, is working to translate these materials into multiple languages, and launched a website dedicated to keeping people up to date with the state's response. You can go on the Department of Health's website, which is NMDOH, health.org or nmhealth.org. And you'll see if you want to learn more about what the Department of Health does, we have a ton of different programs that we do all the time. Everything from public health to providing services for people with developmental disabilities. But if you want to learn more about this specific case, which is coronavirus or the COVID-19 virus, there's a button in the upper right-hand side of the screen when you get in there. Or if you're looking at it on your phone, there's a ribbon at the top that you can click on, and it's dedicated specifically for providing you more information. It has negative test counts and things like that. It also has a lot of different information for providers and just individuals needing to know whether or not, or wanting to know whether or not they have the disease, those kinds of things. With that, I'll go ahead and pass it over to Dr. Landon, and he'll fill in quite a few more details from my presentation. So thank you.
Thank you. Thanks for the invitation to present, and we really appreciate you all coming today. Just wanted to share some information about this particular outbreak and talk about how we're prepared as a state, and we are encouraging people to take this seriously, but not to panic. What I'd like to do is I'll reiterate a few things that Deputy Secretary Chenier said, but I'll be talking about the virus itself a little bit, about the situation globally and locally. What is a pandemic? I'll be talking about that briefly, and talk about current activities in New Mexico to address the situation, and then talk about planning and preparation for potential community spread of the virus in New Mexico. And then I'll talk a little bit about what we all can do, what you can do, at this time. The virus is a member of the coronavirus family. There are a number of coronaviruses. The common cold is a coronavirus, and that's, as you know, that causes very mild illness. On the other side, we have SARS, which is the severe acute respiratory syndrome virus, and that caused a major outbreak in 2002, and it emerged out of China, I think, in November, and then sort of fizzled out in April. With that virus, we had about less than 10,000 cases, and with this virus, we've already had close to over 95,000 cases. So they're quite different in terms of the scope of this outbreak compared to that outbreak. But the SARS virus is viewed as the virus that's most closely related to this novel coronavirus we're talking about today. This virus causes fever, cough, and or shortness of breath. So those are the main symptoms of the virus, and it is felt to be cause more severe illness than the typical influenza virus, and significantly more severe. And it's felt to be there are different perspectives on this, but about as infectious as the seasonal influenza virus. It does affect, it primarily affects older adults with respect to age, and it seems to spare children. So about only 2% of the cases are amongst children less than 18. And that's different from, typically what we see with influenza. That's a big difference for this virus. And we'll be talking about the implications of that for our planning and that sort of thing. The virus does affect, as I said, the elderly more, and elderly are more likely to have complications of the virus, and also persons with chronic disease. such as heart disease, respiratory disease, diabetes. Those persons with those diseases are more likely to have complications of illness. The situation globally, I mentioned there are about 95,000 cases so far, based on the WHO report. And China used to be the country with, well, it still has had most of the cases, about 80,000 cases. But recently, there are more new cases outside of China than in China. So much of the new activity is happening outside of China. And there are over 85 countries with who've had a case diagnosed to date. 3 countries outside of China have had a substantial amount of cases. South Korea's had over 5,000, Italy's had over 3,000, and Iran is close to 3,000 cases. So there's a lot of transmission going on in those countries. And those are the countries we view as, sort of travelers to those countries are viewed at high risk of having the infection. In the U.S., based on the CDC counts from today, and the CDC's counts are what we view as the official counts for the U.S., though you'll see stuff in the New York Times and various papers that we rely on the CDC counts. They're not different. They're not that different between the sources, but the CDC counts are the official ones. So right now there are 164 cases and 11 deaths, and 19 states reporting cases. Texas is having some travel associated cases in Houston, and Colorado has had, I believe, 2 cases. One was a case that was on the cruise ship that's currently just outside of, I believe it's San Francisco in California, being held for folks to be tested there. And so we have some cases in our neighborhood, but those are the Arizona case, the Colorado case I just mentioned, and the Houston cases are all travel-related cases. Now that's a little different than what's going on in Washington State and California. Washington State and California have large numbers of cases, and I think the most recent CDC numbers are, I believe they're between 30 and 50 right now, is what they're reporting for those states, and that reflects some community spread. And I'll talk about community spread in a little bit, but that reflects community spread on top of perhaps the initial introduction of the virus by travel. And CDC is noting that there are currently 36 travel-related cases, 18 person-to-person spread cases, and then 110 cases still under investigation. So there have been a lot of cases diagnosed relatively recently in the U.S. To talk about, what is a pandemic? A pandemic is what's caused by a new virus, a virus that hasn't been in existence before. So this is a new virus. So that meets that criteria. It also, it's also a virus that can cause disease in people. Many viruses just cause disease in other species. It's a virus that can cause disease, can cause person-to-person transmission. So it meets that criteria too. The last criteria, which the World Health Organization, which makes the determination, the last criteria is sustained, widespread transmission. So transmission in lots of places, and a transmission that basically remains in that community for a while. And the World Health Organization has not declared a pandemic yet, but many of the criteria for a pandemic have been satisfied, and we'll just keep track of the World Health Organization's review of this situation. So it's not a pandemic yet, but those are the criteria for a pandemic. What's New Mexico doing currently to address the situation? Well, we talked about the travelers from, these are travelers from level 3 travel advisory countries. That's China, that's South Korea, Iran, and Italy. So CDC has recommended, and all states are doing this, that there be monitoring of travelers and assuring that they don't develop illness, and if they do, make sure they get appropriate treatment. So travelers from those countries, we contact them, and this is within 14 days of travel. We contact them, and we review the symptoms of coronavirus, and we get them to monitor their temperature twice a day, and we also check for symptoms when we call them each day. And then if they should get sick, we work with them to get treated at the most appropriate facility. So that's an important part of our system, and we're able to do this. We did this a little bit with Ebola, when people were returning from the part of Africa with Ebola, and we would monitor their symptoms as well. So we've done this before, and it's a sort of thing the public health system can do if it needs to. We're very fortunate in New Mexico to have a centralized state health department where all the levels of the health department, local level, like your local public health office here, the regional level, where Jimmy and Carrie work in Roswell, and then at the state level, where Eric and I work. So we have an integrated health department, and we don't have separate municipal health departments like they do in some other states. So this allows for more streamlined, coordinated disease investigation, and that's particularly relevant to situations like we're talking about here. Testing has gotten a lot of attention. Initially, the CDC was the only entity that offered the test, but state health departments could get that test done through the CDC, and then that test was made available to state health departments the middle of last week. I mean, it was authorized for use middle of last week, and we started testing at the end of the week at our state scientific laboratory, which is part of our Department of Health, and that's in Albuquerque. That's not a new facility. We've had that facility a long time. State public health laboratories are a really important part of each state's infrastructure to provide public health services. So we have a very good one, and they got the test up and running at the end of last week. On our website today, it's noted that we've done 16 tests for COVID, for this virus, and all of them to date are negative. And a number of national labs are going to start offering the test. For example, LabCorp started offering it today. Quest, which is another national lab, will start offering it on Monday. And we're working with the biggest, homegrown lab in New Mexico, Tricor, to get the test up and running there too. So this should increase testing availability, and more people will be able to get the test if they need it. So who are we recommending the test for at this point, or who are we providing the test for? So we mentioned the travelers from those 4 countries: South Korea, China, Iran, and Italy. So people have come back in the last 14 days who we're monitoring those folks. If they develop fever and cough and or shortness of breath, we would consider testing them. And That's one group. So those are travelers. Then we're also doing some testing of people that aren't travelers. For example, if somebody was hospitalized for a severe respiratory illness, such as a severe pneumonia, and we did not have a specific diagnosis for their pneumonia, we would test them, and that's regardless of travel, and that's to look for just be extra careful and look for a possible case. And then thirdly, we are doing some testing for persons sort of representative of mild illness. Deputy Secretary Chenier mentioned that 81% of people have mild illness with novel coronavirus. So if somebody has influenza-like illness, fever and cough, and they have a negative influenza test, we're going to test some of those people. And that's sort of the biggest category that we're testing right now. We don't have too many people to test in those other two categories. The test is run at the State Public Health Lab for free. There's no cost for the test. And the specimen for the test can be collected anywhere in the state, including here. Some facilities may charge a collection fee for collecting the test, but running the test is free. We're working, other things that we're doing, we're working with the health system, hospitals, clinics, to get them prepared and to maintain that preparedness. So we do a weekly check with each hospital to see if they have enough personal protective equipment. We do a weekly check of hospital bed availability to just keep track of that. We do that during the influenza season too, but it's helpful to continue that now. And we work with the hospitals and labs to evaluate patients and to make sure they know about the procedure for evaluating a patient, for the appropriate infection control approach to the patients, and that sort of thing. We are, as Deputy Secretary Chenier mentioned, we're having lots of different forms of communication. We're having meetings like this. We're having a number of webinars and conference calls with key groups. We are really trying to get the word out. We're relying on local governments to help us get the word out. We put a one-pager together at the end of earlier in the week, basically just to provide some basic information, realizing that our website, not everybody may have access to our website. They may not have access to the internet, so we want to get some hard copies out there and work in collaboration with local government to get that out. And we would do that again if something significant changes in the outbreak. Just to emphasize what we're doing now, we're preparing, and we're ready for what may develop later with respect to this outbreak, and we really think it's important that people take this seriously, but that there's not panic. There's no need for panic. So the second to last section of my presentation, I'd like to talk about how we're planning for potential community spread of the virus. We don't even have a diagnosed case of the novel coronavirus in the state, but at the same time, we want to be prepared adequately. So I want to talk about how we're getting ready for the possibility of community spread. So what's community spread? So I mentioned the Houston cases. There's more than one, but that doesn't represent community spread. Those are all travel-related cases. I believe folks came from, took a trip to Egypt and came back and developed illness in Houston. That doesn't represent community spread. Say, for example, in Dallas, if we die, and this is just a hypothetical, But in Dallas, say they diagnosed a couple cases and they couldn't figure out, they could not track those cases back to a traveler, or they couldn't really determine exactly how the cases developed. That would represent community spread. It would suggest that the virus is in the community, in Dallas, say. So that's what community spread is. One thing that's very important to do in our preparedness for the potential for community spread is to develop alternatives to patient care in person. So typically you go to a clinic or a hospital and you get your patient care right there on site. For the 81% of cases that are mild, and as long as the patient doesn't have a high risk of complications due to the fact that they might be older or have chronic disease, we would work toward having that person taken care of at home, which is the most appropriate place for a mild illness. So how would we support that? Well, there's telemedicine. A number of the managed care organizations have telemedicine, so you can basically conduct that visit in your home and the provider's somewhere else. We'd have a coronavirus phone line where people can call in and get clinical advice and share their symptoms, and we can make recommendations about the best place for them to get their care. The idea is to have as many people who can get care at home to get care at home, and that's going to be best for our healthcare system. So for the healthcare system, we would expect, if we had widespread community transmission of the virus, that there might be there would likely be pressures on the healthcare system, on hospitals, outpatient clinics, that sort of thing. So we're developing plans for alternate care sites, and what we mean by that are ways for people to get care in settings perhaps where they wouldn't normally get care, or we might be able to have additional outpatient rooms at existing clinics, or additional beds at existing hospitals, or we might open up additional space for outpatient visits and inpatient stays. So those are all their plans in place. That planning is going on, and that's important to be ready with those alternatives. Should this outbreak get worse? Social distancing is a very key intervention that we have. So for influenza, where most of our pandemic planning occurs around, we have a vaccine. Well, if it's pandemic, we don't have a vaccine. But for influenza, we have vaccine typically. We don't have vaccine for this new virus. And yet, it's expected it'll take about a year for the vaccine to be developed, or maybe a little longer, but about that ballpark. We also, for influenza, and we use this medication during the last pandemic, H1N1 influenza pandemic in 2009, where we developed some of these tools. We did have antivirals available to treat that virus. We don't have, antivirals don't work very well at treating the novel coronavirus. So social distancing is a major intervention that we have. And so what is that? It's basically having people not congregating in large groups to reduce the spread of the virus. And so the goal of that is to keep people basically away from mass gatherings if we need to, and so we'd be exploring that. So one of the approaches would be to cancel mass gatherings. I believe in Washington State they're canceling a lot of meetings, the larger meetings, and they're encouraging people to avoid meeting in large groups. So we would consider that. We would encourage telework. where employers can allow telework, where that would work, we would encourage that. Also, if the work site, if that doesn't really allow for that, but you need to have a meeting at work, have that by conference call. So people could just basically stay in their offices and have a meeting. I mean, it's not the same thing as being together, but it's one approach to it. And then the other would be to consider canceling school. Now, this is where the planning differs a little bit for an influenza pandemic. For influenza, we would typically have lots of children that would be ill. For this virus, only 2% of the patients that are sick are children. So we don't know how well closing schools would, how good an intervention that would be. And so we're keeping a close eye on what is happening in Washington. They've closed a few schools in Washington, and we were just learning that they're planning on, the University of Washington is planning on doing all their classes online relatively soon. So those are some approaches. So those social distancing is our major intervention. Another activity that we're planning for is to increase our tracking or surveillance of this new virus. So we have a very good surveillance system or tracking system in the state for tracking influenza, which is another respiratory illness. We're one of 13 states in the country that's part of the special network with CDC to really have advanced tracking of influenza. So we plan to use that same system, modify it slightly, and to track the novel coronavirus, should we have community spread. And this would include tracking hospitalizations, coronavirus-like visits, so the visits of a syndrome that caused by coronavirus, and also deaths. So that system we would put into place. And finally, just to finish up, I'd like to talk about what we all can do and what you all can do to reduce the likelihood of transmission. So, you know, we're still in influenza season here, and there are specific measures people can take to reduce the spread of respiratory illness, such as washing your hands, and this is very effective, covering your cough, and not going to school or work when you're sick. I mean, some people, myself included, we think that the thing to do is just sort of power through it and go to work despite have an obvious respiratory illness. Well, you know, if we have community spread of the novel coronavirus, we're just not going to, you know, that would not be a good idea. People need to stay home if they get the virus, and most people would be taking care of themselves at home because they have mild illness. So that's what we can do. We can also work together, make sure people have the correct information about the novel coronavirus like we're discussing today. We can participate in events like this. We can prepare further, and we can maintain our preparedness, which is really important. New Mexico, as a state, comes together and is able to accomplish a lot, and we can do that. We can do that to address this novel coronavirus. We can work together and help our families and communities basically deal with what might happen. So just in closing, I really want to thank you all for your attention, and it's very important that we remember that we are prepared for the virus, and we need to take it seriously, but panic is not helpful. Thank you very much.
Okay. Thank you, Dr. Landon. So at this time, we do want to be thoughtful of everyone's time as well today. So now that we've heard the news and the information about COVID-19, this is going to be the question and answer period. So if anyone does have a question, please approach the podium and please ask your question of Dr. Landon. Thank you.
Attempt and being successful at letting our community know and seeing New Mexico pulled together. I'm a physician assistant in family practice in Clovis. I was wanting Dr. Landon, if he could, answer a few questions. Number one, do we have a time where the World Health Organization would define it as sustained?
There's not a. I mean, I've heard the World Health Organization officials talk about this. They don't have a specific criteria,
Okay.
and they're really, when they sustained would be, it's more the widespread part of it.
Okay.
That's key for that definition of the pandemic, affecting many countries with sustained transmission.
Okay. And you mentioned that New Mexico is monitoring travelers that return to New Mexico, or the CDC?
Each state health department, all 50 state health departments, are monitoring travelers that have returned from those 4 high-risk countries. On a voluntary basis, we're monitoring them and touching base with them daily.
Voluntary. And then I was wondering, how long? Is it 2 weeks? Because I heard that there are some indications that it can be dormant for as much as 6 weeks.
Yes, we're doing that for 2 weeks. And CDC and WHO have looked at this very carefully, and they feel that, typically the incubation period, the length of time it takes for the virus to develop is, around 3 to 5, 3 to 6 days. But we've widened that range to 2 to 14 days just to make sure we cover basically all the instances of developing infection.
Great. And then something in the private office that I would like to have a clarification of. When we order through LabCorp, we have to have a CDC number that LabCorp says we'll get paid for. So do we have a CDC? Would it just be influenza-like? Would it be cold? Would it be shortness of breath? Do we have any of those numbers, or can we go to your site to figure it out?
Yes, you can definitely work with us to figure that out. LabCorp just got up and running today, and so we're still working with them to understand their mechanism completely.
And for all the community, you had mentioned that the testing is free. My question is that when you go through these third-party LabCorp Quest, free is a little different kind of word. I want to clarify, is it free from those companies?
What I meant to say, and what I intended to say, was that the test, when it's run at our state scientific lab, is run for free. The testing through commercial labs will be, the same payment mechanisms will be in play as they are for influenza testing or cholesterol testing or any tests that we do.
I would request the State Department notify I don't know if you can do it, but I'm going to request it.
Sure.
The insurance companies that are vetted in New Mexico and are used, that they will cover it. I don't want to do it on a patient, and it's much easier in my little private practice to use LabCorp, but if they get a test for $3,000 or $4,000, that's not going to be good. So if you could tell them you will cover this at a certain amount and let me as a provider know, so I don't have my patients start shaking in the knees and say, you don't know, you don't do it. And it would be, in my opinion, from what you said, if there's something, the lungs, whatever, all other testing's negative, but it looks bad, it looks like flu, at least occasionally that would be a time. Of course I would look at travel, but still you're trying to look occasionally at others to see if maybe we're missing something.
Occasionally, yes, that's a good point. Well, no, thank you for that advice, and we will explore those things.
Thank you.
Thank you very much.
Questions. Have a great
Appreciate it.
Thank you all very much for coming out and visiting us out here. I've just got a couple of quick questions. You had mentioned you're doing screening and monitoring of travelers. What type of coordination's been done with the DoD? With the Air Force Base here, they use chartered commercial flights, military air flights that don't go through regular airports. You guys probably aren't aware of their travels. What's being done for the service members and contractors on base that are traveling through affected countries, coming back into our community?
The federal government is doing monitoring as well. They've probably done as much monitoring as the states. And for federal employees, including military, they're under their review and auspices.
I understand that, but at the end of the day, they get off the airplane and then they're in downtown Clovis at Albertsons. Are they being screened, or do we not know? Is that?
We'll need to touch
Okay.
base on that one. But
Thank you.
the federal government is working
Right, I know they have
to do
jurisdiction,
monitoring
but
as well. Yeah.
They still live within the community that offers a chance for
Right,
spread.
right. Good point.
The other question I have is, I've heard on the news, and you mentioned elderly or immune compromised people need to worry. Can you expand more on compromised immunity? Is hypertension included in that? Cardiovascular issues? What exactly are we talking about for compromised immunity?
Right. No, good points. So we have seen that this is all based on China data, relatively recent data. We do know that there are higher rates for diabetes, higher rates for heart disease, and I don't know if hypertension is being included in that definition. And then higher rates for most respiratory diseases. So for those, in general, those chronic conditions. And as time goes on, if this virus
Better, more
continues,
information. It's new. I
spreading.
understand you don't have all the information. It's brand new to you guys too. So.
right, we'll get more information about that.
And then lastly, you mentioned you were going to monitor Washington as far as closing schools, children not being affected. Do we know yet as far as children being carriers? If we don't have to close the schools because they're not affected, can they go home and bring it home to their grandparents or parents, even though they are asymptomatic?
Right, now that's a really good question. And the World Health Organization had a team that included some CDC folks that took a look at what was going on in China. And they, in their report that came out earlier this week, they determined that they did not see, they could not find an instance. They didn't say it couldn't happen, but they did not find an instance of transmission from child to parent. It seems like the transmission, their feelings the transmission is most likely the other direction. And that's where, so that's reassuring in terms of children being together and transmitting to others. So that's
Awesome. Thank you very much again for coming out and being with us today.
Thank you very much.
Dr. Landon, we have a question from Facebook asking about if you know anything about TRICARE doing testing, or TRICARE testing.
That's a good question. I don't know about TRICARE doing testing, but we can look into that. Yes.
I have a question. As a nurse in a long-term care facility, are we treating symptomatically, or is there a treatment that we can do for our elderly?
There's not, we don't have the antivirals that we do, say, for influenza. So
Right.
like in your facility,
Like the
you probably
Tamiflu's
use a
work.
lot of antivirals during the influenza season. We don't have that option yet. I mean, there are trials. National Institutes of Health is looking into it, but we don't have anything right now. But hopefully something will develop, because I'm sure there'll be a lot of attention to this. You may have heard that President Trump signed, I believe it was $8.3 billion bill to provide lots of support for lots of things to better address this problem. And he just signed it, I guess it was yesterday. So that should bring more resources to bear on finding new treatments and that sort of thing. So for your sort of setting, you know, we've been very fortunate in New Mexico that the long-term care institutions have done a great job addressing influenza. How does this relate to novel coronavirus? Well, many of the non-medication interventions to address this novel coronavirus are really the same ones we would use to address influenza in terms of cohorting patients and things like that. So we're just going to have to be very, very careful about that population, about the population of long-term care centers when we have evidence if we have evidence of community spread. We're going to be very careful about that, and we're going to have to continue to get ready for the possibility of that.
Okay. Thank you, sir.
Thank you very much.
Hello, my name is Melissa Gunn, and I'm the personnel coordinator for Curry County. And so we have a lot of individuals who work for us, our employees, who handle money and transmissions with the public through money. And I was wondering if there's any precautions that we as the employer or our employees can help protect any kind of spread through that.
Okay, yeah, good question. So when we talk about this virus, we talk about being careful with wiping down high-touch surfaces for the virus. That's a general respiratory illness prevention measure. We don't have good evidence that this virus is transmitted through surfaces. We think it could be, but we don't have a lot of evidence of that. We really think the major transmission mechanism will be through sick people, and not through this surface or something like that. We want to be careful and wipe those down. And I don't think we have any specific need to be specifically concerned about money.
Okay.
Thank you.
Thank you very much.
Okay, anyone else have any other questions?
I'm Karen Stevenson. I'm a school nurse at a small school close to here. I'm wondering, it sounds like things as far as school closures are maybe up in the air a little bit since, only 2% of children. What about extracurricular activities like basketball games where a lot of adults are in, together, and what criteria would you have for closing those types of things?
Yes, good questions. So we would, so as you mentioned, we're not, it's not perfectly clear about the best approach to closing schools at this point. And we're going to use the evidence from other places, as much science as we can, to help make those decisions. But as you noted, because only 2% of the cases are among kids, that may not be what we're doing. But if we're bringing together large numbers of adults at sporting events, that may be a problem. It's not a problem right now because we don't have a case diagnosed in New Mexico, but it's something to be thinking about. And so if we had community spread, we would definitely give consideration to recommending closure of mass gatherings, including sporting events like you mentioned.
Okay.
Or canceling those events.
Right. A lot of our students transfer in from Clovis. Mm-hmm. So if there was a case, let's say in Clovis, and you were going to close the Clovis schools or even their events, would it be the surrounding schools as well?
It's in Washington State they have closed. They haven't done, it doesn't, or at least a couple days ago they had not done district-wide closures. It was in sort of individual schools. We've had a meeting with the Public Education Department to start discussing this, and they're working with superintendents now to discuss it further, and we'll be working with them closely to figure this out. But it's, if this was an influenza pandemic with a severe virus, virus that causes severe illness, it would be a very relatively easy decision to probably recommend closing schools. This virus is different, and so we have to think about it differently.
Okay. One other question. We have a lot of travelers, back and forth to Mexico. And are there any cases in Mexico?
The last time I checked, which was Wednesday, we had, there were 4 cases in Mexico. Now, there may be more now. The first 2 were travelers from Italy, the first 2. And the second 2, I don't know if they've determined where those, how these people were infected. But so there is some infection in Mexico, but as of right now, substantially less than what's in the amount of infection going on in California and in Washington State.
Okay, thank you.
Thanks.
Good afternoon. I'm Jessie. I'm with Roosevelt General Hospital. My question's a simple question. As far as phone line, you mentioned that patients could call and be screened over the phone. That would help our healthcare facility so much. Do you mind sharing that number?
Oh, we're getting that ready. So
so it's still in the works.
Yes.
Okay.
We had, I can tell you a little bit about it because we
Okay.
did the same thing during the 2009 H1N1
Okay.
pandemic. So we had, we basically had one number, and from that one number you could reach, you could get clinical advice or more general advice, and then you could also get to our epidemiology hotline to work on to talk to us about a very specific case. To
Correct. We know
consult on that.
healthcare workers can currently use that line, but yeah,
Right.
I'm thinking for the general public, because our phone lines are very overwhelmed right now with concerned citizens, and it's a lot of education, and a lot of times our folks that are answering the lines, they don't have the knowledge that the healthcare workers do. So we're just trying to. The workflow is getting bogged down
Right.
due to phone calls. So we're hoping there would be something in place. But do you know roughly ETA when this would be up and running?
We're working on it. We're working on it very hard right now.
Okay.
I don't have an ETA, but we really appreciate the demands you all are facing, and we're facing some of those, not the same demands, but so we really do. I agree with you. We really need to get this up and running.
Okay. All right. Appreciate you guys.
Thank you.
Thanks.
Thanks.
Thank you, everybody. Quick numbers question. Once Quest and LabCorp come online coming next week, how will that impact the sample capacity that you'll have for testing?
So it should help. It should help out a lot. I mean, commercial labs, state public health labs in general provide specialized testing. Like we do hantavirus testing there, plague testing, sort of specialized testing. The labs with the high throughput are the commercial labs. They really have ways to ramp up testing, and so we would expect this will really make a difference.
Would you have a number on that?
I don't have an actual number.
All right, Lee.
Thanks.
Hi. I hope this isn't a silly question, but should we determine we have a patient that we want to test, what do we gather? Is it a nasal swab? Is it a throat swab? What is the test?
Yeah, I mean it's a swab, and it's either nasal and or throat. So we can use either one.
And how is that? I mean, like, how do we store that until it gets to whatever testing
It goes
facility?
in basically the standard viral medium, and with the swab, and then it's shipped through the regular mechanism to the state scientific lab.
Okay.
So it's pretty. If you all were going to send a flu swab for that test, you basically would do it in the same way as you do.
Well,
as
our
you do.
particular clinic, we do all of our testing in-house, so I wasn't sure.
You do the rapid test
Yes.
in-house and that sort of thing. Yeah, and so our state scientific lab on their website, they can do it by phone. They can work you through all those steps.
Okay, thank you.
Thank you.
Hi, I just had a quick question. You were saying that it's person to person to catch it, but the virus is still alive on a surface for 9 days, correct?
You know, the virus, it's not known exactly how long. I mean, this is a new virus.
Right.
It's really not known exactly how long this virus lives. But the virus is not felt to be very hardy, and it does not live that long. So we're not having to work on special approaches to clean for the virus. We can use the traditional approaches, the traditional cleaners that we use to disinfect work for this virus as well.
Okay. One other thing, like during the H1N1, air dryers were still prevalent, being used in public places. Is that something that they may want to shut down? Has that ever been addressed?
So,
air hand dryers.
Right. You know, that's a good question. I haven't heard about that. We'll have to look into that.
Yeah, I always wondered because it's just
Yeah.
blowing it all around.
Yeah, I mean, it's not something I've seen brought up, but
And the
it's
air
a
comes
good
from
thing to
inside
be.
the bathroom.
Yeah, no, that's good.
So-
Good thing to mention. Yeah.
Okay, thank you.
Thank you very much.
Okay, anyone else?
Hi. Thank you guys again for coming. I appreciate it. So it passes through droplets, correct?
That's correct.
Has this been aerialized?
That's a good question. There's still a little bit of discussion about that. The World Health Organization does not feel like it's airborne.
Okay.
They feel like if you do what we call an aerosol generating procedure, such as intubating someone or that sort of thing, working with their airway, that you could generate, they could become airborne by doing that procedure. But routinely, they feel that it's not airborne. CDC is recommending airborne precautions for the virus, and they're being very cautious about that. I mean, that may change, but at this time, we are operating as if it's airborne, even though I mean, that's a very cautious approach, and it's probably it is the most appropriate approach right now. But as more information comes along, that may change. So a little bit of a different view from the World Health Organization versus the CDC on that.
So then, assuming that it was aerial,
Yes.
what is the effectiveness of spraying Lysol in the air? I mean, is it actually grabbing the particle and killing it that way, or I mean, how is that effective?
I don't necessarily think that's very effective to spray Lysol in the air to try to reduce airborne transmission. I think we're focused, as you said, on the droplet, sort of the within 6 feet sort of transmission, and that's the most worrisome part of it. We're being, extra careful to cover for the possibility of airborne transmission through the use of personal protective equipment, and that spraying in the air does not have a big role in reducing infection.
Excellent. Thank you, sir. I appreciate it.
Thanks.
Thought I'd get by with somebody would talk about churches, but they didn't. So, what's your recommendation for churches? Pew backs, everybody grabs the pews, communion trays, songbooks, rotating 100, 200 people every week. What's your idea?
That's very, very good question, very important question. A lot of people come together, and a lot of people that might be more high risk. So for influenza season, there are special things that we think about. For novel coronavirus, at this time, there are really no recommendations at this time for novel coronavirus because we don't have a case in New Mexico in terms of churches. You would practice the good recommendations for preventing or good measures for preventing respiratory illness, such as washing your hands, covering your cough. Don't go to church if you're sick. I mean, you don't share that with your fellow congregants there. Now, if we had community spread, then we would need to talk about the possibility or the recommendation of possibly canceling church service because it's a mass gathering. I know that would be hard on a lot of people, and that would really affect many people's lives, but it may be necessary. That recommendation may be necessary
down the road sometime.
Down the road. It's not something we're thinking about right now. Not something we need to do right now.
And everybody hears elderly. What number are you using? 65 and above? 70, 75?
Pretty much. I mean,
don't get jumping.
Pretty much. The severity of the illness does increase as people age further beyond age 65. Okay. So, but generally we're talking about 65.
So for a church building right now, just only thing you might add is door handles, sterilized, wipe down door handles.
Right, with the standard cleaner that you all use should be fine. Yeah, you don't have to do it obsessively, but on a regular basis, that would be good.
And let them know basically the information you've got and try to remove some of that, because you're talking about elderly people. A congregation these days, a lot of them are elderly people, so they're going to start worrying about it right off the bat. And
yes.
Okay,
definitely.
Thank you.
Well, thank you.
Go ahead. We have time for
Dr.
one more.
Lane, we have a question on Facebook about the turnaround time for the test.
At the state scientific lab in Albuquerque, where we have our existing lab and we've implemented the new test, the test takes about 4 hours. So anything that comes in the morning, we generally will run that afternoon. If we have a particularly high-risk patient to evaluate with a lab test, we can run that anytime that we need to.
Okay. All right. Was there one more? Okay. All right. Well, everyone, thank you very much for coming out today. We appreciate your support. And if you do have any other further questions, feel free to contact Mr. or Dr. Landon with any other questions. But we do thank you. And then the flyer that we do have handed out, that's out in the lobby area, we'll talk to the counties and cities to see if we can get those posted on their websites as well. That way they'll have those available. So we thank you again and have a great weekend. Thank you.
Thank you. Thank you very much.